I often hear that higher educated people are healthier in old age. Do I have to worry now if I don't have a university degree?
Absolutely, you're doomed. No, I think there's a lot of misinformation about the extent that successfully higher levels of education actually matter for health. And part of what we're increasingly learning is that it's not a straightforward process, and perhaps the things that you learn earliest in an education are the things that matter most for health. We certainly see that in sub-equatorial places where people get relatively low levels of education, but the difference between no education and primary education is fundamentally important for health and longevity. So I think that may be the story that we're starting to see in the Northern Hemisphere as well. I think there's still a little bit of mystery to it, perhaps a lot of mystery to it. The thing that I'm becoming increasingly interested in is what's called cognitive and non-cognitive abilities. And these are traits or characteristics of people that tend to emerge relatively early in life. There's some evidence that they predate people's entry into formal schooling. So the degree to which there are measured and large differences in cognitive ability, the ability to problem solve, the ability to think through situations, the ability to process information, may be things that are established age 5, age 4, age 6, before formal schooling kicks in, and certainly long before we start to make measured differences between people with respect to educational attainment. And the other part of it is what we call non-cognitive abilities, which are basic things about sociability, basic things about being task-oriented, basic things about being committed. The degree to which people vary in terms of their ability to deal with everyday life, their ability to manage situations. And I think those things tend to be increasingly important in understanding who goes further and who doesn't go further in education, and I think are very clearly connected to health dynamics. There's a debate in health circles right now about how complex the management of health is. In my view, the management of health in routine situations is not complex. It involves avoiding risk behaviors, not smoking, not drinking to excess, not doing drugs, avoiding dangerous situations, getting a moderate amount of physical activity. All of these things, if done reasonably or if managed reasonably well, will promote good health over the life course. There's no question about that. So if you think about basic cognitive and non-cognitive abilities, those tie directly into the ability to avoid risk situations, the ability to understand medical information, the ability to think through risky situations, the decision not to smoke, the decision to avoid peer pressure. All of these things are things that tend to be associated with cognitive ability and people's non-cognitive skills. Sure, absolutely. I think the bigger issue is that there's a push in some circles to think about education policy in general, which is to think about the whole range of starting in kindergarten and going all the way through to university as an effective tool for health policy. And I don't really see that as being particularly effective. If I was to think what would be the important policy implications, it would quite simply be make investments and make them early so that people are hitting the ground running when they get into school so that they can capitalize on their educational opportunities. And if you couple it with, as you said, some level of health education, particularly health education that targets a wide variety of risk behaviors, you're likely to put people on the right path towards good health. Because the one thing that we do know is that it's cumulative. Sometimes it involves shocks at different points in life, but for the most part, people who have weight management problems have had weight management problems for decades. People who smoke started early. People who use drugs started in their teen years. People who drink to excess, that was showing up in the teen years, early adulthood. So none of this stuff is a mystery by the time that we start to look at the age of onset for serious disease or mortality risk, which is typically after 45 or 50. I'll give you two. I'll give you 6 and I'll give you 4. 6 is the number of times your risk of being in poor health is multiplied if you have serious excess overweight versus whether you have a college degree. It's 6 times more important that you're obese as opposed to having a college degree. And it's 4.5 times more important as to whether you smoke as to having a college degree. So if I was to think about where I would put my money and put my investment, I would put my investment in figuring out how to manage people's weight and figuring out how to have people avoid risk behaviors like smoking.